Hey guys, this is Leah, and I'm here actually with Sabrina today. We're going to be doing our first co-host of our Career Snapshot series.
Yeah, I'm super excited.
We're here with Jim Gatewood and Brian Maddox, two incredible guys who've had really interesting careers, and we're going to pick their brain.
Yeah, so I want to ask, what is your career, first of all, and if you don't mind, letting us know a little bit about it.
Okay, so when I graduated from college, I knew I wanted to go into sales. My dad was a salesman all his life, and he moved into management, but I knew I wanted to go into sales. So when I got out of college, the job that I got into was selling crackers, believe it or not. I sold crackers in the southeast of the country. I had three states. They gave me Florida, Alabama, and Mississippi. And so I drove around those three states selling crackers.
What kind of crackers?
Yeah.
I worked for Sunshine Biscuit, which is a big cracker company. I did food service, so I called on restaurants, any kind of food service, so restaurant, hospitals, not really the grocery store. But after doing that a couple, 2-3 years, it wasn't a long-term career for me. I could see that. So I started interviewing, and I interviewed with this company called Ethicon. And this was before the internet was big. So I went to interview with Ethicon, really not knowing that much about them and what they did. But they were a part of Johnson & Johnson. And Ethicon Inc. sold sutures. So we sold, when you go in to get stitches at the doctor's office or a hospital, we sold those stitches that they put in there. At that time, Ethicon had about a 90% market share. So that's what I started doing. So they gave me a territory in Virginia Beach, and I started calling on the doctors at hospitals and trying to sell the sutures. With any kind of medical device sales, it's mostly hospital based. With device sales, we work with the surgeons in surgery and help them use our products. A typical day for me would be going into surgery with probably 3 or 4 cases, depending on how long they are, helping the surgeons use my equipment that day, and that's what you did. And I probably did that. I did that for 31 years. So I worked with J&J for 31 years, and I retired at 56. But I really did love the day-to-day working with the surgeons. I always felt like I was there as a consultant, kind of helping them. I always said they knew the operations really well. Although we had to go through 8 weeks of training. We worked up at our home office with a doctor who had taught the residents, I think at Rutgers for many years, and then he taught us anatomy. So I always said that the surgeons know the procedure better. I know the instruments really well, and so that's how the two of us work together.
That's super interesting, especially when you think about sales. You don't really think about kind of sales as you're creating solutions to problems, but you're not like hand in hand in the operating room, like helping in that capacity. I always kind of suspected it would be in a conference room or in an office where you're talking about it, but you're not seeing it live in action and seeing your product being used for good. And so I bet that was really rewarding.
It was. I mean, I know Jim's going to touch a little bit on the training that we went through and how we help the surgeon. We wouldn't show up into surgery with a brand new instrument typically without showing it to the surgeon outside the OR. And we even had labs where they could go in and use the instrument. But still, we were experts on how that instrument worked. And you worked with the surgeons that were using it, but then they also had all their support staff who had to load the instruments, had to get the instruments on the sterile field, clean the instruments. So there was the support staff, the nurses, techs, and all those type of people. You would also work with them to make sure that the instrument was put together correctly, and then they'd give it to the surgeon and that they used it correctly. And then if you had to reload or something, we would work with the staff to get that done.
Wow. Yeah. So it was a very diverse role. There were multiple hats you were wearing, it seems like. And so I appreciate you for giving us kind of a well-rounded view of what you do and what your 31 years, right? was like. And so, yeah, now I'm going to kind of bounce the ball over to Jim in the next window to talk about a little bit about the education. I know Brian mentioned some of the trainings that you were involved with, and it seems like it was, pretty extensive training, I would imagine. So I'd love to hear, and we're curious to hear more.
Yeah, so you would go in-house for 4 weeks, 2 weeks of training, and that's all about the company, about the sales process, and certainly the products as well. You'd be there for 2 weeks, and then you go home for a week, and then go back to the home office for another 2 weeks. And it's a long training process, but they absolutely are certain that by the time you are out in the field and working with your doctors and your nurses, that you know exactly how to handle yourself, you know what the answers to the questions are. And if you don't have the answers, you know who to go to get those answers. So it's 2 weeks and then a week at home, then 2 more weeks in home or at the home office training. And then they would send you to a field trainer, which my territory was here in the Virginia Beach area, but my trainer was in Atlanta. So then I went to Atlanta and I worked with him for a month. And so it's a very long process, but the result is that they have representatives in the field that are extremely well educated in the products and in the surgeries in which the products are used.
Wow. Yeah, I mean, that's great. It seems like they give you a lot of tools to succeed, and that, you were able to ask questions and you had a lot of different people that you could reach out to that were experts that could give you feedback or answer any questions that you might have had once you got on board. Now, I do have kind of a piggyback question. So for those people who might be looking to make a career pivot into this type of, device sales or, medical instrument or device industry, do you need to have certain credentials to even be considered? Like, do you have to have, a marketing degree or a communications degree or a business degree? Like, what does that look like? Are there people from all over the place? Bless you, Leah.
You have to have it for most of the surgical device companies. I don't think I can say all, because there are some different kinds of entities within that space. But for the major companies like Johnson & Johnson and Medtronic, and there are many, many others, college degree is required. It doesn't matter what the degree is in. With Johnson & Johnson, it certainly didn't matter for me. My degree is in psychology, but they don't really care about that. They just care that you're a 4-year, that you have a 4-year degree. So that's really what is required. Most hiring managers want to see some type of sales background, but that could be as little as, while I was in college, I waited on tables. That's a great sales experience. It's also a hard job. So that if you did that for many years, that's also a good sign. So a lot of people say, well, gosh, I could never do a sales job. And then I start asking them questions. What did you do in high school? What did you do in college? And chances are they've had some kind of a sales background. Right. So a little bit of a sales background is important. College degree is essential. And a good track record is absolutely mandatory, and nowadays some volunteerism as well, and somebody who's very, very well-rounded, and so on.
That's great. Well, thanks so much for really elaborating on that. And also, one thing that I heard was the fact that you were open to feedback. You were like, hey, you put yourself out there and you're like, what do I need to do to be sales manager? And that can be a really hard question to, I think, ask, because who knows what the answer is going to be. But way to go for being brave, and also to look at all the opportunities that you've had. We might think of, waiting tables as not sales, but you brought that, in as a really effective way of sales. So I thought that was really interesting. Thank you.
Well, thank you. So since I know these guys very well, I know one other training that they had to do while they were at Johnson & Johnson, which I thought was really cool. So can you guys talk a little bit about the car training that you had, the driving training? Do you remember when you shared that with me? I feel like that's a fun thing that might drive people towards Johnson & Johnson.
Yeah, can I take that one, Brian?
Sure.
Yeah, so Johnson & Johnson has a program called Safe Fleet. And we all had company cars, right? So we're driving their cars, and they insure us and so on. So the Safe Fleet program was an ongoing program that would be They would have sections and time allotted for during our sales meetings. We talk about driving techniques that enhanced safety. But then the most fun part of Safe Fleet was every 3 years, you would do a behind the wheel portion. And they would take an entire day and you would go to wherever the course was being held. Sometimes it was here close to my home. Sometimes I had to drive maybe an hour or two away to go to the course. And the course was either led by state patrolmen or by companies that now do this as a part of their business. They do advanced drivers training. And it was partly classroom, but there also was partly on the range. So they would put you in your car and put you and your car through maneuvers. And I actually saved myself from being in an accident once, because one of the things that they taught us was what to do when you are forced to activate your anti-lock brakes. They learned through the research that a lot of people, when they slammed down their brakes and heard the clicking, it scared them. So they took their foot off the brake and they got into an accident. The other thing that they taught you was that once you activate your anti-lock brakes, you can still steer your car. And so they have you do that as an exercise. Well, a month after taking the course, one day I was on a boulevard. It was a rainy day. I almost rear-ended somebody, and I was going to make impact with them, but I activated my anti-lock brakes, and I knew that the lane next to me was open. So I turned my car to the right, and I saved myself from being in an accident. So it was a fun day behind the wheel, and always that's something I look forward to.
Thanks for sharing that. I know when you shared that with me originally, I thought that was a great story. And if you like driving, it sounds like this is another component to this job that,
yes,
that there's a lot of driving. Yeah, that's great.
Right.
So Brian, can you tell us what has been your favorite part of your career?
So with J&J, I think Jim and I both hit it almost perfectly, because what we both like to do is you like training surgeons on new techniques, new procedures, and you like being in the mix. And it was great when they would call you and say, hey, I can't do this procedure unless you're there today, or tomorrow, you schedule it with them.
Yeah, I just want to, I guess, support what Brian said, and it's that it was a great career because too often in sales, you don't feel like you're bringing value. You feel like you're selling a product. And this was not anything like that. This was bringing incredible value. Matter of fact, you had a responsibility once you've been trained on a product. There were surgeons and nurses out in your territory that were waiting for you to come and show them, because they know that it's coming and they've heard that it's better than what they have now. I definitely agree with Brian. I felt so blessed to have an opportunity not only to work for Johnson & Johnson, but to have worked in the great industry that surgical device is.
Last question, and it's our fun one. So if you were a potato chip, what flavor would you be?
Or a cracker, because
maybe a cracker. Yeah, let's go with a cracker. And Jim, you never told us, what did you sell? Maybe that's even more interesting.
Yeah, what food product did you sell?
I worked for a company that doesn't exist anymore called American Home Foods, but I sold Crunch and Munch, Jiffy Pop popcorn, Goulden's mustard, Lux beans and peas.
Can't believe you still remember.
That's awesome. Okay, we'll go with what you can choose. What type of cracker or what type of potato chip?
I would say jalapeno, some type of spicy potato chips, just because I like lots of different things in life. I like variety, so something spicy and a little hot would be good for me. That'd be good potato chip for me.
We've gotten a lot of jalapeno chips that we've been interviewing. I love that. How about you, Jim?
So I think that I would love to think of myself as a jalapeno potato chip, but I'm probably more like an original Lay's potato chip. Because as exciting as I think I'm really pretty much just a plain potato chip.
Well, maybe it's also that you're loyal. You're consistent.
You're classic.
You can always, right, classic.
Right?
Yep.
Classic.
Yep.
You can't go wrong.
And Jim is not giving himself credit. He's way more than a classic potato chip. These guys are amazing. I've had the opportunity to work with them in a lot of different areas. And not only are they wonderful salespeople and have special careers, but they are incredible volunteers as well. So thank you guys so much for joining us on our career snapshots, and we really appreciate it.